Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and I'm also a nurse educator. In today's video, I will be going over 5 NCLEX prioritization questions courtesy of nursing.com. Nursing.com has NCLEX, which is adaptive like the NCLEX, study plans, practice questions, cheat sheets, courses. They definitely give you a lot for your money. If you're interested in checking them out, you can check out my affiliate link in the description below. Let's start. A nurse is caring for a client who just had a liver biopsy due to a history of cirrhosis. Which of the following is a priority nursing intervention for this client? So this person just had a liver biopsy. If they have a history of cirrhosis, the liver, remember that the liver creates clotting factors. We're worried about bleeding with this patient. So the priority intervention, you don't want to change the dressing right over the biopsy site because he just had it. You want to position the client on the right side. You want to position the client on the right side to apply pressure to the biopsy site to prevent bleeding. This is the top priority to decrease the risk of bleeding for this patient. The other thing that nursing.com does for you is if you missed a question, you can review the rationale videos here. This was a medium question. 57% answered this correctly. You can pause to read the rationales. Question 2. After receiving report, the nurse is deciding which tasks can be delegated. The nurse knows that which of the following should not be delegated to the nursing assistant: emptying a urinary catheter and charting the output, performing a swallow screen, taking a set of vitals, sit with a suicidal client. They are not able to perform a swallow screen because that involves assessment. The nurse should perform any assessment such as a swallow screen. Everything else is appropriate. This was easy. 88% answered this correctly. You can pause to read the rationales. The nurse receives report on a client with active chest pain and a type B aortic dissection noted on the CT. The client has an arterial line placed. Which is the most important vital sign to monitor? So when someone has an aortic dissection, the risk is that if it ruptures, their blood pressure is going to tank. So I'm going to go with blood pressure. A client with a dissection will have very strict blood pressure parameters, which are usually on the lower side of normal. This is necessary because increased pressure in the vessels increases the bleeding. 4 ambulances arrived to the emergency room. The nurses note to see which of the following clients first: fish hook caught in the lower lip, no, eliminate it. Fell off the bike with arm deformity, bluish fingers. Traumatic leg amputation, bleeding through gauze. Motor vehicle crash, I guess, or MVA is usually what motor vehicle accident is usually what I see, with neck and back pain and limited range of motion. I'm going to go with this because they're bleeding through the gauze and they could bleed out. This client has lost a limb and is actively bleeding. The active bleed puts the client at risk for hemorrhagic shock, making this client the priority over the others. This person would be seen after, so this would be first, this would be second, this would be, I would say third, this would be fourth. A registered nurse has a large caseload of clients to care for in a rehabilitation facility. She has a certified nursing assistant working with her who is able to provide some client care as well. Which of the following tasks would be most appropriate to delegate to the certified nursing assistant? Administering insulin? No. Checking gastric residuals on a feeding tube, suctioning a client's mouth and nose, collecting a urine sample. This is the most non-invasive task a CNA is qualified to assist. Thank you so much for watching. Make sure you smash that subscribe button. I'm trying to reach 30,000 subscribers by the end of September. It helps other students find my channel. And the challenge for today is go out and do one random act of kindness. Until next time.